Well, thank you very much for asking me to speak to your group. I'm Kevin Kavanagh, who is board chairman of Health Watch USA, and I'm going to talk to you today about COVID-19 along with vaccines. During this presentation, I'm going to discuss the COVID-19 virus, the spike protein, severity of COVID-19 infections and reinfections, vaccines, both types and efficacy, different types of COVID and coronavirus variants, side effects, vaccine hesitancy, and finally, safety monitoring. Now, SARS-CoV-2 is the name of the virus that causes the disease, which is called COVID-19. This virus is a coronavirus. It's related to the coronavirus which causes the common cold, but SARS-CoV-2 attaches to a special receptor called the ACE2 protein, and this receptor is found throughout the body. Now, the common cold, for example, will cause a runny nose, sneezing, and these are quite common symptoms for having a cold, but they're rare symptoms for COVID-19. The COVID-19 virus attaches and enters the cells of many different organs of the body, not just the lungs. It affects the blood vessels, heart, central nervous system, liver, gastrointestinal tract, kidneys, and testes. This is one dangerous virus. So we're going to talk about the severity. Last year, life expectancy has fallen by 1 year. So the U.S. life expectancy in 2019 was 78.8 years, and in 2020 it was 77.8 years. It fell by a year. Non-Hispanic blacks had a decrease of 2.7 years, Hispanics 1.9 years, and non-Hispanic whites 0.8 years. And this was, of course, more prevalent and more pronounced in frontline workers because non-whites make up our primary frontline workforce. And this also reflects a tremendous disparity in both healthcare availability and in the type of risks these workers are taking. This virus is aerosolized. There's no question about it in my mind. You've got an excellent report from the National Academy of Sciences, which details all of the evidence. N95 masks are required, as is proper building ventilation. This includes both air sanitization and complete air exchanges. But few workplaces have this, and because of that, in the absence of the above, vaccinations are imperative. That is your best defense from getting this virus. According to Newsmax, and this is a right-wing source, the CDC's reported that we have nearly 600,000 excess deaths, which have occurred over a 1-year period of time. Now, if you count the actual dead, we're up to over 500,000, but not everybody's counted. The reporting system is not really as robust as you would like it. If you look at excess death data, we're approaching 600,000 deaths. Again, a very dangerous virus. And 30% of individuals which have asymptomatic or mild COVID-19 infections are still symptomatic at 6 months. This was from a study of 177 individuals. Over 90% had either mild or asymptomatic disease, and they still had symptoms. Most common is fatigue, which was in 13.6%, and loss of taste or smell, which is in 13.6%. And as an aside, I can tell you that through this pandemic, people that have lost their taste and smell have kind of mitigated or downplayed its severity. But as an ear, nose, and throat surgeon, I can assure you, if I did a surgery and that patient woke up without the sense of taste or smell, I could be sued for multiple dollars, and believe me, it would be a serious problem. So even these problems are serious. But too many of these patients also have chronic headaches, trouble breathing, chronic muscle aches, sore throat, chronic cough. It may be in the range of 5%, but if you've got mild disease, you don't want to have 1 chance in 20 of having chronic problems. And if you're hospitalized, the chances of having heart damage are approximately 20%. And if you're in the ICU, a very significant portion of patients have either heart damage or they can also have pulmonary and lung damage. Pulmonary fibrosis is going to be extremely common with this. It's unfortunate, but it's going to happen. So when you hear this narrative, oh, patients have survived, patients are, going home from the hospital, they're not talking about chronic disability because this is not the flu. It affects every organ of the body. Now, there's also concern about reinfections. In January of this year, the Public Health of England released a study which showed that if you had a past infection, it provides 83% protection against reinfection compared to others who did not have previous COVID-19, and that this protection lasts for at least 5 months. So 83% protection is fairly good. It's not 100%, but unfortunately, if you have a mild to asymptomatic case, your protection's not going to be that great. You don't mount a huge antibody response. If you have a severe case of COVID-19, you'll be more likely to have a very robust immunological response and be protected, but you may also have chronic disability and chronic disease problems from COVID-19. If you received a vaccine, you still can become infected. And there is a lot of concern about this. We're just getting data coming in. But there was, for example, a report of a Congressman Lynch, who had 2 doses of the vaccine, was COVID-19 testing negative, but then was exposed to someone who had COVID-19. They retested him. He turned positive. That means he acquired the infection and had to self-quarantine. Now, he did not develop any symptoms. So you may say, why is that? Well, the vaccine is given in your arm, and that's where it produces an immunological response. So the response is mainly one of in your bloodstream and when the virus invades into your body. When you catch COVID-19, it invades and reproduces in your nose. And so at that point, it has the potential of spreading. You won't have symptoms. Then when it invades into your body, if you have a vaccine, your body kills the virus dead. However, there's still the possibility that before that happens, the virus is spreading. I think on the positive side is the new study out of Israel, which presents data. It's not a for sure study as far as its results go, but it's very encouraging that the vaccines do prevent asymptomatic carriage. After 2 doses, you would expect 90% prevention. So again, it's not 100%, but it's good prevention. But this is one of the reasons why, if you get a vaccine, you still should be wearing a mask and still should be social distancing. Now, unfortunately, when you talk about variants, all bets are off. There was a very instructive happenstance which occurred in Manassas, Brazil. This is a town which was in the Amazon region. They had a severe outbreak of COVID-19 in 2020. A lot of individuals died. Close to 76% of the population became infected. Rates fell, and it was felt that they had reached herd immunity. And then the virus mutated. This is the P1 variant, which is very similar to the South African variant. And this is a graph. Look at the upper graph, where early on you see the first peak. By October, almost everybody was expected to be immune, or the town had reached herd immunity. But in November and December, again, a huge resurgence of infections. This was caused by the P1 variant. These infections produced even more deaths and more patients infected than the original peak. So variants are an extremely large concern. So let's talk about the virus itself and what is a virus. The coronavirus is composed of a strand of mRNA which is surrounded in a lipoprotein capsule, and on it are little spikes, and these spike proteins allow it to enter the cells. Now, as an aside, lipoprotein means just that. Lipids are fats. This is why washing with soap and water is so effective at killing this virus. It may be even more effective than using alcohol. If you use alcohol, it should be 70% or higher. And of course, you want to wash your hands for at least 20 seconds. Personally, if I have soap and water available, I wash my hands. That's my primary way of disinfecting. If I don't, I will then use a hand rub or alcohol, which is at least 70%. Now, RNA viruses are known to have a high mutation rate, and mutations which involve the spike protein, those are the ones that we're concerned about, and those are the ones which are of importance. Now, your body will produce two types of antibodies. One are binding antibodies. They bind to kind of the surface of the virus. They're not really critical in killing the virus, and they don't really bind to critical parts of the virus. But the other type of antibodies your body produces are neutralizing antibodies, which bind to the spike protein and inhibit cellular entry. And these antibodies are very important in your immunological response. So everything is based upon the spike protein. There's your body's immunity, there's vaccines, and the PCR and antigen tests. All are based upon that. Now, I should note that when we talk about vaccines, and this is our next topic, that vaccines just look at the spike protein. That's what they concentrate on. So they just produce neutralizing antibodies. And that's one of the reasons why vaccines actually produce a stronger immunological response and stronger protection than natural immunity. Of course, the other reason is if you get 2 doses of the vaccine, it's like getting the infection twice and not once. So there's 2 reasons. It's a more specific targeted response that's more likely to kill the virus, and you have 2 exposures. So let's talk about the Pfizer and Moderna vaccine. Now, the Pfizer is actually Pfizer-BioNTech. BioNTech's a German company that they partnered with. And these 2 vaccines are mRNA vaccines. These vaccines deliver mRNA into the cell, so the cellular machinery can actually make the spike protein. This spike protein is then delivered to the body's immunity cells, which then cause it to learn how to kill the virus and produce an immunological antibody response. These vaccines do not affect the DNA. They bypass the DNA and directly instruct the machinery of the cells on how to kill the virus. Now, Moderna and Pfizer deliver this mRNA in a capsule that's composed of polyethylene glycol, or PEG. This capsule doesn't elicit a response in most people, but there are a few people that are allergic to PEG. PEG is used in really a lot of pharmaceutical products, so it is commonly used, but there are rare people that will develop an allergy or severe reaction to this. Johnson & Johnson has developed a vaccine which I expect will be authorized by the FDA tomorrow. This vaccine uses a modified adenovirus to deliver DNA into the cytoplasm of the cells. Thus, someone who is allergic to PEG may be able to take the Johnson & Johnson vaccine. It should be noted that the mRNA and DNA in these various vaccines just contain the coding for the spike protein. So these vaccines cannot make the full virus. A lot of people will say, well, are these vaccines rushed to market? And of course, the answer is no. We have known about coronaviruses for over a decade. It's the #1 virus that people felt was going to cause a pandemic. SARS and MERS outbreaks, which were near misses, were of the coronavirus. So they've been working on these vaccines and technology for over a decade. So in essence, we already had a coronavirus vaccine which was almost completed. All they had to do was plug in the new genetic code for this spike protein as compared to the other. Kind of similar to every year when we come up with a new flu vaccine. So no, they weren't rushed to market as far as development and science. This has been going on a long time. Can mRNA alter DNA? Answer again, no. mRNA is very fragile, doesn't last a long time. This is why the Pfizer Moderna vaccines have to be stored in ultra cold, and they are designed to work in the cell's body. The mRNA does not enter the nucleus where the DNA resides, and it's not been found in the nucleus. So again, these are very safe types of vaccines. There's also another vaccine which I think will also get approval from NOVAVAX. This is also an American company, and their product has a number of spike proteins which are stuck on little particles, and that's what's delivered into your arm. And so these spike proteins then directly elicit the immunological response. So it bypasses cells altogether. The advantage of the former vaccines is that they can be made quickly, and in my opinion, they may well make more spike proteins by having the cells in your arm pumping these spike proteins out. So I think that they have an advantage. But all of these vaccines, what goes on just goes on in your arm. It doesn't spread throughout your body. It's just where the vaccination site takes place. Currently, NOVAVAX is in phase 3 clinical trials, and I suspect that they may well get approval. A fourth vaccine you hear about is the Oxford ASTRAZENECA vaccine. This vaccine delivers DNA, not mRNA. It delivers DNA in a modified chimpanzee adenovirus. The DNA goes into the cells, doesn't go into the nucleus, just goes into the cytoplasm outer portion. It makes mRNA, which then makes the spike protein. The big advantage of this vaccine is it does not require freezing. It can be refrigerated. This can go out into rural areas. It can go out into third world countries. So this has a lot of advantages. It is somewhat more scarier for the anti-vaxxers because you've got a chimpanzee adenovirus, but you know, SARS and COVID-19, that's an animal virus also. SARS is an animal virus. There are also animal viruses of flu, avian flu. Although they usually don't infect people, you commonly get viruses jumping from one species to another. And of course you have DNA, which is a scary term to people, but again, the DNA resides in the outer part of the cell. It does not modify the DNA inside the cell nucleus, and whatever is going on is just going on in your arm. It doesn't go out throughout your body. Now, so how effective are they? Well, our current variant is the D614G variant. And this is more infectious than the original Wuhan variant, and it's the variant we've been dealing with in the United States. The Moderna and Pfizer-BioNTech vaccines are over 90% effective in preventing COVID-19. That's any symptoms of COVID-19, whether it's mild disease or severe disease. They are also very effective in preventing infections from the United Kingdom variant. That's the B117. Now, the United Kingdom variant is felt to be the #1 variant in the United States come March, and it is 70% more lethal and 70% more infectious. So believe me, this is a good reason to get this vaccine, because if you don't get it and you get exposed to this variant, you may well have a severe outcome. Now, the Brazilian and South African variants are problematic. They tend to evade vaccines. There is a 3 to 6-fold decrease in efficacy of the Moderna and Pfizer-BioNTech vaccines as studied in the lab. We don't really have field data or actually how it works in people, but when you look at the ability of the antibodies to bind and knock out the virus in the lab, 3 to 6-fold less effective. But here's the thing with the Pfizer-BioNTech and the Moderna vaccines. You've got good protection to our original variants with just one dosage. You get the second vaccine dose, you now have a 10-fold increase in antibodies. So if you get a 10-fold increase and a 6-fold reduction, you're still well within the range of killing this virus. So you may get mild sickness or moderate sickness, but it's unlikely that you'll have severe disease, hospitalizations, and death. So again, get the vaccine. Now, both Pfizer-BioNTech and Moderna have announced that they are taking necessary steps to develop a booster shot and updated vaccine. Moderna just yesterday submitted their new vaccine for the South African variant. So it looks like, and this is kind of something my granddaughter is a little mad because I told her the bad news of this is that we'd all have to get a shot for a vaccine. Then I had to tell her 2 shots, and well, now it might be 3 shots, which is not good. And we need to keep staying up with these variants. Hopefully, the new Moderna vaccine can cover all of these variants, and that would again put us back into a 2-shot type of a course. But my opinion is, I think this is going to be like the flu, where every year we're going to be needing to get an updated vaccine or shot for this virus. ASTRAZENECA vaccine has been discontinued in South Africa. Obviously, that's where the South African variant is more prevalent because this vaccine was shown to not be effective in preventing mild and moderate COVID-19, but severe disease wasn't studied, and that's really what Pfizer, BioNTech, and Moderna are best at preventing. So it still may be effective, they just don't have the data, so they're going with the vaccines that we have the data on. Now, is natural immunity better? A big no. Natural immunity may not last long, maybe only 1 to 2 years, but its duration is felt to be linked to severity of disease. In other words, you get really sick, maybe with chronic problems, you have more apt to get immune to the virus. Mild and asymptomatic infections, not much effect, not much immunity. South African and Brazilian variants, however, there is grave concern with natural immunity. They will cause reinfections. And by the way, both of those variants are in our country. So far, we have had 75 million doses delivered. As of February 20th, we have had 61 million doses administered, and I would expect by now we would have close to 75 million doses administered. And again, 40 plus million people have received 1 or more doses of the vaccine. So a lot of people have had this vaccine, very few problems being reported as compared to having 2 to 3, and at one point even 4,000 people dying a day from COVID-19. Side effects. Well, side effects are to be expected, especially with these vaccines. They're similar to severity to your shingles vaccine. 70% people reported pain, 33% fatigue or headaches, 23% muscle pain, and 11% reports chills, fever, swelling, or joint pain. There's little difference between Moderna and Pfizer BioNTech. People generally, however, have a harder time with the second dose than with the first. And so that's something to remember. And oftentimes with the second dose, you may not feel well enough to go to your work for 1 or 2 days. So if you have to go to work, I would get the vaccine on a Friday so you have the weekend that you can recover. Now, you can still get COVID-19 before you get the vaccine and within a few days after you get the vaccine. And you might pick it up while getting the vaccine. So if you develop symptoms of loss of taste or smell, shortness of breath, sore throat, or diarrhea, please get a COVID-19 test. These tests are not affected by vaccinations. So the PCR test is not affected, the antigen test is not affected, but antibody or serology tests may be affected. It depends on the type of test. As a side note, if the test is testing for S protein or for the spike protein antibodies, they will be affected. If the test tests for the binding antibodies, then it won't be affected. Because remember, the body makes both. Vaccines only make the ones that kill the virus. Now, most major side effects to vaccines occur within 2 months after administration. We now have 6 months worth of data. Data is constantly being collected. Probably the most common reaction being reported, and that is anaphylaxis or an allergic type of reaction to the Pfizer, BioNTech, or Moderna vaccines. Personally, I think that this is being due to the PEG, and a lot of people believe that it's due to the capsule, but these reactions are quite rare. With Pfizer, they're occurring at 4.7 cases per million, approximately half that with the Moderna vaccine. They're occurring within 15 minutes after administration, and they're treatable. No one has died of these reactions yet, compared to the thousands and thousands that are dying each day from COVID-19. There have been deaths which have been reported to the FDA which occurred after vaccination, but only 196 deaths compared to 60 to 70 million vaccinations. So this is a very small number of deaths, especially when you're vaccinating people who are very high risk or who are in nursing homes. And so the CDC has studied these and found no causative link between the two. In other words, these are high-risk individuals that are getting the vaccine because they're high risk, and they probably would have died regardless of whether or not they got the vaccine. So again, very small number, but they have not been linked to the vaccine. Now let's talk about vaccine hesitancy. According to USA Today, only 56% of people surveyed in January wanted to get the vaccine, but that was up 10% over December and 30% over October. IPSOS, which is a French marketing and polling firm out of Paris, France, they found that 71% of individuals in the United States intended to get a vaccine. That's not nearly high enough, in my opinion, but that is good. We are much better than, for example, Russia, and we're even better than Japan, South Africa, and France, but not nearly as good as Brazil, China, Mexico, and Italy, where you have 80% or more of the individuals wanting to get the vaccine. And unfortunately, there's hesitancy in healthcare providers. This figure is from a publication in the CDC's MMWR report. The graph or country showing on the left of the United States is of nursing home residents who have received a vaccine. And as you can see, you've got over 60% of nursing home residents, and in many states, over 80% of nursing home residents have received the vaccine. But the United States figure on the right is showing nursing home staff members. In a large number of states, including Kentucky, you have less than 50% of the staff members have received the vaccine. And this is a problem. We have hospital staff members and healthcare staff members in rural Kentucky that do not want to receive the vaccine. And again, this has to do with misinformation. And we're not talking about doctors or nurses here. We're talking about all sorts of different staff members. Now, in Western Kentucky, school districts were polled, finding 50% and in some cases 70% of school staff didn't want to have the vaccine. Governor Andy Beshear, in a press conference, stated that, well, in Kentucky, 70% of people in school districts want to get the vaccine, but this desire is much more common in the urban school districts than it is in rural. So again, there's a problem with convincing people to get a vaccination. Why is this? Well, I feel it's due to disinformation on the internet. There are very organized campaigns of detailed false data which is being released on the internet. A study by Carnegie Mellon University found that nearly 50% of accounts tweeting about the coronavirus were likely bots. And the European Union released a study showing that Russia was deploying coronavirus disinformation to sow panic, and that this was creating confusion and inability for the EU and their public health agencies to communicate a response. And this is very bad. And you combine that with the Carnegie Mellon study of bots which seem to follow Chinese and Russian disinformation playbooks, it really does raise your eyebrows of what we're up against. I have had trolls come onto our websites and you trace them back and they appear to be from foreign countries. Disinformation abounded in their tweets. and in their postings. I've even had a graph which was purported to be CDC data that showed the number of excess deaths per year and said there's no excess deaths of any of the years. It's CDC data. Here's the reference. Check it out. Well, I checked it out. It wasn't exactly what was on the CDC site, but the big thing I noted was the 2020 data, it was only half there with the CDC. They hadn't posted the latter half of the year. So if anything, they showed we had twice the number of excess deaths that year as compared to other years. But that's not what was being explained by this individual posting it. And he was very aggressive, very abrasive to individuals that were disagreeing with him. And again, this is a very organized effort, and it has really, in my opinion, weakened our country and weakened our economy. So let's talk about vaccine monitoring. Now, just because you get a vaccine dosage and your study has stopped doesn't mean you're not still monitored for complications. You are. And a large number of people who receive the vaccine are also being monitored. So right now, we at least have 6 months of safety data, which is pretty good. If you get a vaccine, you should be given a slip for the VSafe program. This is an active program where you get a smartphone app. You're sent a text message daily for the first week, weekly for the next 5 weeks, then at 3, 6, and 12 months. You're asked about your symptoms. If you report you're not doing well, then in all likelihood, you'll be contacted by either the CDC or your state health department to see how you're doing. And again, all this data is recorded. So we are monitoring for vaccine safety. And there is also the VARS, which is the Vaccine Adverse Event Reporting System. This is a passive system. This is constructed by and co-managed by the CDC and FDA, and this is where patients or healthcare personnel can go on to report an adverse event which is associated with the vaccine. Doesn't necessarily have to be caused by, just associated. So if there is a vaccine administration error, adverse event, serious adverse event, if there's multi-system inflammatory disease, or if a patient has hospitalization or death, a healthcare provider is required to report this to the FDA. So this is mandatory reporting. And they have to report severe events. And severe events are fairly well defined. They are either death, a life-threatening adverse event, inpatient hospitalization or prolonged hospitalization, if someone can't conduct normal life functions, if there's a congenital anomaly or birth defect, or if someone requires medical or surgical intervention to prevent the above from happening. So this, again, is another safeguard. Shown here are a number of different programs, some of which survey medical records of individuals who have received vaccinations. This is what has occurred in Kentucky, with the majority of our acute care hospitals participating with the program. In addition, the Veterans Administration surveys veterans who have received vaccinations, looking at their medical records and making sure that complications or problems did not develop. So all of this adds to our data on vaccine safety. So the longer we go, the more we know these vaccines are safe. And we have a number of web links here for you to go to. One is cdc.gov/vsafe, and the other is vars.hhs.gov. Both of these links are very good to use, and believe me, if you have a vaccination or you get vaccinated, enroll in the VSafe program. Now, this PDF should be posted along with a link to a video of this presentation on the Guild website so that you all could watch this later offline or download the PDF, in which case the web links you can just click on and it will take you there.